Morning guys, it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today we're going to talk about everything you could have a question about regarding dog and laboratory testing. Just like humans go and get blood work done, so do our patients, and it's super important. I'm just going to go ahead and jump in here. So biggest thing for me on our lab work is we have to remember that dogs and cats age a lot faster than we do. So for every year that we 365 days, their bodies are aging, 7. That's a long time. So here at Four Paws, we recommend annual lab work. It's really important. This blood work is checking a multitude of different things. So it's checking a red blood cell count, a white blood cell count, platelets. Red blood cells are important because if we don't have any, then we know we're anemic and we know we need to dig into that and find out why. If white blood cell counts are either lowered or elevated, we know either infection or do we have inflammation or what's happening to the bone marrow where we're not making white blood cells if we have low white blood cells. Platelets are important because those help us clot. So if we don't have enough of them, we can start bleeding internally or not be able to clot. So that's super important for bleeding functions and trying to not bleed because bleeding is not good. We also are going to be testing liver and kidney values, pancreas values, cholesterol, triglycerides, electrolytes, thyroid, urinalysis. I mean, there's a lot of things that our lab testing includes, and this gives us a snapshot into how is your pet doing? How internally are they doing? Because I can take, a 6-year-old lab that looks happy-go-lucky and is like, more treats, more treats, more treats. And maybe we're doing completely fine, but I get the lab work back and maybe our liver values are elevated. And my job is to go, okay, well, why? If we have a healthy dog with these changes, why are they there? And we dig into that. So it helps us catch diseases before they're symptomatic, which means they're easier to treat. It's better to catch diseases early. So these are kind of some of the things that we test for and we look for in our animals. And then I might get the question, well, Dr. Denney, why do we need lab work every year? Like what is that going to tell us if it was normal last year? And I'm going to say, well, a lot can change in a year. A lot can change in a month. There are some cases where we'll have an annual and we'll get annual lab work, and then a month later I'll have a pet come in that's sick. And do you know what I'm grateful for? I'm grateful that we had baseline labs from a month ago or a year ago where I know what their normals were. What are their normals? When we do these lab works, we know what their yearly normals are. So when things change, it helps us better make a diagnosis and form a targeted treatment plan. So, it's really important. And we talk about this every time I see patients. Definitely I recommend it yearly, but at least at a minimum, any patient over the age of 5 should be getting yearly lab work, without hesitation, even if it's just a mini panel of those chemistries to just check in and see how liver and kidney values. I can't tell you how many times we've caught things on these preventative blood panels that if we hadn't caught them, we wouldn't know until the pet was super sick and maybe maybe they wouldn't make it. So these lab panels make a huge difference. So other diagnostic tests are like a urinalysis when you're looking for UTIs. We can see bladder, urinary crystals. We can see white blood cells. Sometimes we can see cancer cells in urinalyses. So there's a lot of benefit to be done with these diagnostic testings that we're doing. We'll even do ear discharge analysis in the clinic. So if your dog has an ear infection, is shaking and flopping his head and his ears are red or they smell, first thing my nurses or my techs are going to do is they're going to get swabs of those ears, and we're putting it on a microscope slide, we're staining those slides, and we're looking at the microscope slides under high definition and high magnification, looking for bacteria. Well, what kind of bacteria? Well, what about yeast or what different types of fungal disease? What about ear mites? So we're looking for these things. A blood smear can be done to look at the red blood cells, looking for blood-borne parasites. Or do we have we been bit by a snake? That's happened recently. And the venom changes the membrane or the outside of the red blood cells. So usually red blood cells have a very round, smooth outside. When you've been bit by a snake and the red blood cells come into contact with that venom, they get spiky. And you can see that. With a blood smear, I diagnosed a dog with a snake bite just by doing a blood smear last week. So, a lot of these things that maybe don't seem like a big deal actually tell us a whole lot. Like a skin infection, we're going to do a skin cytology. meaning we're going to take an impression smear on the skin, look under the microscope, stain it, and look. And I've caught cancer this way, fungal infections, bacterial infections. Sometimes we can even see mange, which is a type of skin mite. So there's a lot that we can do and find out from these diagnostic testing that may not seem that important, but they actually are. Like, I know my patients that come in with chronic ear infections because maybe they're dealing with some allergies, they get ear swabs every time. Because what if the infection's changed? And what if I just throw medications and it's not the same infection as it was last time? And now we've wasted an appointment and meds, when if we had done an ear discharge analysis, I would have known exactly what we were treating. So that's why those kind of tests are so important. I think that's going to kind of round out in general some basic information. If you do have further questions, please feel free to give us a call or make an appointment. Thanks so much, guys.